Hi, I'm Dr. Susan Rothenberg. I'm an obstetrician and gynecologist and an assistant professor of obstetrics, gynecology, and reproductive science for Mount Sinai. I'm also an internationally board certified lactation consultant with a background in breastfeeding medicine in addition to OBGYN. We have all of our nurses on labor and delivery and our postpartum unit are trained in breastfeeding support. In addition, we have lactation consultants available on our postpartum unit and also in our neonatal ICU to help people who need a little additional assistance. So we encourage you to put your baby skin to skin as soon as possible, immediately after delivery, directly on your belly. The goal is to have your baby latch at the breast within the first hour of life. We'll teach you the feeding cues so that you'll know when your baby is interested in breastfeeding, and we'll encourage you to keep your baby with you at the bedside so that you're attuned to those cues. Yes, absolutely. So newborn babies should be fed on demand, which basically means that you should feed them anytime that they're showing signs of being interested in being at the breast. In the first few days and weeks, that usually amounts to about 8 times in a 24-hour period, so about every 3 hours or so. So you can tell that your baby is well fed if your baby is actively sucking and swallowing at the breast, if they seem calm and relaxed after a feeding, what we call milk drunk, if they're making wet and dirty diapers, and if their weight is appropriate. So it's normal for babies to lose weight after birth in the first few days, but if that weight loss is more than expected, we'll work with you to help you optimize your breastfeeding. So if your baby is doing all those things that we just talked about, then you know that your baby is making enough milk. In order to make sure that you make all of the milk that your body is capable of making, you really want to empty your breast frequently in the first few days and weeks. Milk removal is your body's signal to make more milk. So the more often and the more thoroughly you remove milk, the more milk that your breast will make. So again, in the beginning, that's about every 3 hours to make sure that you make plenty of milk, but don't worry, this stage does not last very long, and soon your baby will be going longer stretches between feedings, especially at night. So you should continue to eat a healthy diet while you're breastfeeding, just like you did during pregnancy. Most of the food restrictions that we gave you for pregnancy will go away once the baby is born, although you do need to still be careful about mercury, so limit your intake of low mercury fish. We recommend that you continue to take your prenatal vitamins for as long as you're breastfeeding. So our lactation consultants will work with you if you're needing extra assistance. They'll teach you different holds and techniques that will help you to optimize your breastfeeding, and they'll provide you with resources near home that will help you have ongoing support once you leave the hospital. Absolutely. So first of all, I recommend that you find a provider that you trust who welcomes your questions and makes you feel comfortable. Chances are that they're going to practice at a hospital that shares those same values. I think if breastfeeding is important to you, then you should work to find a hospital and an obstetrician and a pediatrician who have the knowledge and the resources that you need to help you meet your goals, because we want you to be successful in whatever your goals are that you set.